The thing that I think is really wonderful about these decision aids is this is not a taped lecture by a physician, just repeating what I said in the office. These are patient stories. And there is nothing I can say in the office that replaces watching a patient similar to you with your same health problems who's made a decision on a treatment plan or a screening test. That resonates so much more deeply, I think, with a patient who's watching that decision aid outside of the office, and that's something I can never give. It's really, the patient stories are so much more meaningful, and that's one part that perhaps we haven't articulated enough about the beauty of these videos, of these decision aids, is that they're really helping patients make decisions by hearing other people's stories, and I think that that's a really wonderful part, and that's what the message I just want to get across. So I think they save time because I find that my patients and their families can come better prepared for discussions. If I've given them some preliminary information through a decision aid, for example, just today I saw a man in his early 70s who has severe emphysema, and hearing him in the waiting room, hearing him struggling with his breathing made me think we need to really make sure we're addressing advanced directives just one more time. But this is a complicated discussion and one that he's not prepared to have today and didn't bring a family member with him. But I'm going to make sure he leaves knowing that video is coming to his house that we have about peace of mind and stories about advanced directives. And I asked him the next time to make sure his wife and his daughter come to the visit, and I called them afterward and said that a video was coming and I'd like them to all watch it together and then come talk with me. So that really helped us focus our visit today on the medical concerns, but prepared me for a really well-informed discussion at the next visit with the whole family. So it certainly saved me time in that way, rather than spending a lot of time on the phone or spending a lot of time talking to the patient about something that I think he'd be well served by watching other families' experiences with. It certainly saved me some time, just that one example. But I think really people come to the conversation much better informed, and that's how it saves me time.
I think the biggest value to using a decision aid with a patient is the fact that it makes the patient a more informed partner in their own care. They understand what's going on with their condition or their anticipated surgery, and it makes them just a better partner in the whole procedure. I think patients have responded very well to the personal care that the nurse in our clinic was able to provide them. Her ability to spend time with them, to go over the decision aids, to show the decision aids with the patient, just has completely amplified the benefit that they get out of the aid. Well, this absolutely takes the burden off the physician. The physician doesn't have all day long to sit and spend with the patient describing all of the various intricacies of a decision aid. Having a nurse be able to spend quality time with the patient, explain it, and only bring those important pieces back that the patient didn't understand back to the physician saves a ton of time.